Hi, and welcome to day 10 of my 10-day self-challenge to do 10 videos related to diabetes in 10 days. My name is Maureen Sullivan. I'm a registered nurse, a certified diabetic educator. My website, maureensullivanrn.com. Today's video, number 10, is on prediabetes. And I know I've talked about it on previous videos, but I kind of wanted to do a deep dive on prediabetes today because it's affecting so many people. And so many of those people don't even know they have it. Can you imagine having a condition, a disease process going on, and you're not even aware of it, but all the damage is occurring as we speak? So pay attention, drop me a comment here on what you think about the video. Consider sharing it with family members or friends who might be in a similar situation. And of course, as always, consider subscribing to this channel because I'm excited to go with you on this journey. So prediabetes, as I said on a previous video, affects approximately 1 out of every 3 people, meaning look to your left, look to your right, one of you probably has prediabetes. The numbers, according to the Centers for Disease Control, are somewhere near 96, 97 million Americans alone have prediabetes. The shocking number that I am most concerned about is that anywhere from 8 out of every 10 of those people, 80% of those people don't even know they have prediabetes. And it's kind of a multiple issue as to why they don't know about it. So I wanted to give you some really strong, concrete numbers to consider sharing or opening dialogue with your medical provider at your next visit. So, like I said, impaired glucose metabolism, impaired insulin function here. We're talking about fasting blood sugars anywhere between 100 and 125 milligrams per deciliter. The normal considered is below 100. And as I said before, above 126 is considered confirmatory for diabetes, although it should be done at least twice here. From an A1C standpoint, 5.7 to 6.4% is considered pre-diabetic. So what does that really mean? That means that something is going on and for some reason you are not able to metabolize glucose appropriately. You have higher than normal glucose levels in your system. And the issue is that a lot of people are not concerned about that, even in the healthcare industry, until it hits a certain parameter, and that being type 2 diabetes, being confirmed with fasting blood sugars of 126 and above, or an A1C level of 6.5 and above, because pre-diabetes, and this is an opinion on my part, is usually not treated with medication. And so while I say that, the medical provider might just say, let's observe it and keep an eye on it and lower your sugar and we'll, your sugar intake, and we'll check in 3 months, 6 months, or maybe next year. The issue is some of them don't even have that conversation, or they have that conversation with a patient or a person with prediabetes who doesn't really grasp the significance of that conversation, or they don't even share your lab numbers with you. And a lot of people have just said, well, they didn't say anything was wrong, and that doesn't necessarily mean that nothing is wrong. So always know your numbers. That's a key issue here with this healthcare professional. Always know your numbers. So like I said, the pre-diabetes situation, the elevated blood sugar levels, they're wreaking havoc on your system. And the sad situation that is occurring is that many people can be pre-diabetic for as much as 8 or 10 years. So can you imagine having a medical condition, a disease, if you will, that is going on for 8 or 10 years and you're not treating it? So you know right then and there that there's a lot of issues with that. So ask for your fasting blood sugar and ask for hemoglobin A1C. What are your risk factors? Well, there could be a family history of diabetes. You could have excess weight that you need to lose. You could be not as active as you could be. You may have poor eating habits. You may have a diet that's heavy in saturated fats and processed and refined foods. All of those contribute to the probability that you might not be in your healthiest state. And that's the nicest way to put it. You might not be in your healthiest state. So step back and kind of take a snapshot of your diet and your activity level day to day and consider, are you at risk for a medical condition such as prediabetes? So have that blood test done and then find out your numbers. And so like I said, then what do? then what do? Because like I said, most people are not put on medication in a pre-diabetic state. And so the important thing, it's not about a certain diet. This is about a lifestyle change. This is something that you need to address yourself and figure out, what can I do to improve my overall health and well-being? And for each one of us, it may be something different. It may be losing some of that excess weight. It may be increasing our water intake and cutting down on those sodas. It may be eating fresh and wholesome foods instead of prepackaged and fast foods and, pizza on a speed dial kind of thing. And so you have to decide, what are you going to change to improve your health and your overall lifestyle behaviors on a day-to-day. But the nice thing is that these significant changes, and they're small changes in the scheme of things, can really improve your overall health, and it may make the difference between a pre-diabetic state and progressing to diabetes, because as much as 30, maybe even 70%, some studies that I was reading last night, of pre-diabetics left untreated progress into type 2 diabetes. So why would you not consider lifestyle changes when it's in your, it's in your possibility and your behaviors, versus going on prescription medication and, risking lifelong complications because you're under treating or not appropriately treating this medical condition. So like I said, I will put additional links in the comments section of this video. It's all about pre-diabetes. And like I said, find out if you're at risk, find out what you can do to change, and take every opportunity, because prediabetes is a significant medical condition. Like I said, left untreated can progress to type 2 diabetes, but the changes necessary to reverse prediabetes or put a stop to prediabetes are well within each and every one of us in terms of our abilities and our capabilities. So that's video number 10. I certainly look forward to your comments, your feedback. Let me know, as I say on all the videos, what's your fasting blood sugar? What's your A1C level? And what is your dialogue with your medical provider? Because I'm very interested in seeing how it's being addressed out in the medical community. So for now, thank you for tuning in 10 days in a row here. It's been a pleasure. And we'll back off on the frequency of the videos, but we're definitely going forward with the channel. So again, my name is Maureen Sullivan. My website, MaureenSullivanRN.com. Like us, comment, share us, and how do they say it? Hit that subscribe button. Have a great day. Thank you.